Welcome to the Beverly Hills Plastic Surgery Podcast. I'm here with Dr. Calvert, fresh off a batch of very dirty jokes, which unfortunately we cannot share, but they were...
How do you out me like that?
They were pretty good.
I just work here. That's all.
I'm not saying them. I'm just saying that they were very funny. Look, today we're going to be proper and we're not going to get canceled.
You said that our listeners would clutch their pearls, so we can't do that.
I did. Although actually I have a higher opinion of our listeners. I think that they do have a very good sense of humor because they are listening to us.
Yes, our listeners do. I get it. But the comparison would be like, I can't believe they would tell jokes like that on their podcast. So we can't do that.
We can't do that.
No.
So instead we're gonna keep it very mainstream
PG.
here. Very PG.
Although I did notice in our last podcast that aired today, there was a very strong BS call in one of the lines that I was wondering, like, Sean, can we say BS on this? I think we can and still keep our clean rating.
Yes, we haven't said the F word yet.
No.
So.
No, and in fact, when we now I do a hockey podcast also, and like the first guest I had on was John Blue. And within 2 minutes, he F-bombed and I just went, and there goes my clean rating on the Dr. Hockey podcast. But I think we've kept it. I think
we're okay.
But he's a pastor, and of course, so he felt like F-bombing early would be good.
Okay.
Yeah.
Well, we will refrain.
Thank you.
We will refrain and keep us very dignified. And today, more importantly, what we're talking about are this new influx. We're all very familiar now with these weight loss medications, the Ozempics, Wegovy, Mounjaro, Zepbound, you name it. We all know about them, right?
I think you just named them all.
I think we just named them. Yes, and so these are all, we're not going to get in the weeds with what they are, but those are all the brand names of these weight loss medications. But due to national shortages of them through a kind of a loophole in the FDA rules, compound pharmacies have been able to make generic versions of these medications, and that's what you're seeing being sold on all of the med spas, your doctor's offices, the Hims and the Hers websites, because theoretically the name brand ones are in short supply, and so these generic compounds are allowed to be made. As a result, everyone and their mother is on these medications. Great, fantastic. I mean, they really truly are miracle working drugs. They assist in weight loss. They help so well with diabetes and intractable patients that have failed insulin and all other kinds of diabetes regimens.
It's amazing.
It's amazing. They really are truly helpful drugs. I've seen them take patients with fatty liver cirrhosis and bring all of their liver markers down. Like, they do a lot of good. And they help you lose weight. And in some patients, it can be a lot of weight. And the one in particular that I'm thinking of is Mounjaro. I've seen a lot of patients on Mounjaro or Mounjaro-like compounds lose crazy amounts of weight, 90 pounds, 150 pounds, like the kind of weight loss you would typically only see with surgery.
Right. And that's the key because, when you get surgery for weight loss, there's a lot of counseling that goes into it. And one of the big points about that weight loss is, by the way, you might need some plastic surgery with all this weight loss.
Yes. I mean, so these are bariatric surgeries, the ones you've heard of, the gastric sleeve, gastric bypass. These are surgeries that rearrange your internal organs to help you lose weight. And in order to have these surgeries, especially here in the U.S., typically they're done at bariatric surgeries of excellence. They have a whole system for you. You come in, you're approved, and then you have 6 months of being on a certain diet. And during those 6 months, you have monthly meetings with your dietitian, with a therapist. I've gone and given talks about plastic surgery. Like, they really prep support groups about what you can expect through your weight loss journey process. And one of the key things that most of these centers, I would hope, mention, especially the ones that I work with, mention is that, by the way, once you lose this large amount of weight, you are going to have a lot of excess skin that you will need plastic surgery to remove. That's just, and they know that going into it, they're prepared for it. what we're seeing with these weight loss medications, which are having similar effects as the surgeries, is that patients are not getting anywhere near that amount of counseling. They're going to some telemed doctor who barely even examines them if they even look at them, and they're prescribing these medications. There's no therapy, there's no nutritionist, there's no support groups, there's no one telling these patients what to expect.
Nope, and that is the problem. And all of a sudden, here are these patients that have skin.
So much skin.
And skin everywhere.
Like their skin has skin.
Their skin
has skin.
That's true. Yeah, and it's, you kind of got to deal with it because that skin doesn't go away. So there's one way it goes away, which is surgery. With maximally invasive surgery, as I call it.
Invasive.
Body
this is not
lifts and all
where
that.
Body Tight and M-Sculpt and Renuvion, all these little cutesy things that claim to tighten skin will help. In fact, I have one patient that I'm thinking of. She came to me after losing, 100 pounds on one of these medications. And she was a young girl, and she really did not want incisions and scars on her, which I got, but I was like, you kind of need them. She's like, yeah, I don't want them. I'm like, but you need them. But I don't want them. Okay, fine. So we did total body liposuction. I did total body Renuvion, which is a skin tightening device. And 3-4 months later, she was like, okay, yeah, I need a tummy tuck and a brachioplasty and an upper body.
You think?
Yeah. So yes, we kind of shrunk her a little bit, and she was not as bad. So we were able to sort of convert her from a lower body lift to a tummy tuck. Her scars didn't have to be as extensive, but now she's undergoing a second round of surgery for twice the cost as if we had just done the initial one. So these patients usually need big deal surgeries to remove the extra skin. And that's okay as long as you know that's going to happen. And I feel like that message is not getting out there because people think I'm just going to lose weight and I'm going to be smaller and I'll be in a smaller dress size and my jeans will fit better. And yes, all of the above are true, but you're going to have extra skin of your arms, of your thighs, of your stomach, and the one that really gets people, of their face. This is the one thing I don't think people realize is how much quick weight loss ages the face. And I see it in so many people. Young women that should look like they're 30, 35, look like they're 45. Because that weight loss in the face, A, you lose volume in the face, and B, you get extra skin. So you have hit facelift territory way earlier than you would have otherwise.
Yeah, and that's a really common issue in weight loss in general, but certainly when it's rapid, you're going to see more of the skin issues because if you bring it down slow, think about it. It's like you have this tissue expander in you that you're, chunky, and then as you lose the weight, if you do it slowly, then your skin can rebound somewhat.
Right.
Not completely,
but to a better degree. It's the same concept with pregnancy, right? You have this kind of quick expansion of your abdomen, especially in someone that may be kind of small to start out with. And then one day you just pop that baby out, and that's very fast. And so that's why a lot of times these women do have problems with extra skin after pregnancy. And so a tummy tuck or a mommy makeover after pregnancy is still much different than these weight loss patients. Because in an average tummy tuck after pregnancy, it's usually just the front part of the abdomen that's been stretched out because of baby and some weight loss. And so a tummy tuck, which removes extra skin of the abdomen, works great for that problem. But when you've lost weight, it doesn't just come from the center part of your abdomen. It comes from the center of your abdomen, from the flanks, from the back, from the upper body, from the arms. It's a full circumferential full body thing that a simple cutesy little tummy tuck doesn't always correct.
So should there be counseling for patients that are being placed on these medications, onto Mounjaro or Ozempic or Wegovy? Should you get some sort of, hey, by the way, is that something that you think the primary docs or the prescribers should be doing?
Absolutely. I think there should be way more counseling about these medications across the board. If you're getting these medications from the PA at your med spa, fine, it's easy, but there should be way more counseling that goes into this than just here are your medications. It's a lot, and And the physical stuff aside, there's a whole mental component to these things as well.
For sure.
Patients that have had a lot of weight for many years and now all of a sudden have lost it, like the mental thing hasn't changed. And so there's so many things that go behind weight gain and weight loss that are emotional, that are mental, that are physical, that have an endocrine component to it, the thyroid levels, the liver levels. Like all these things need to be monitored. That's why these bariatric centers do all of that, because they know that.
Right.
And I think that the medications have not quite caught up to that, and the demand is just so great for it. It truly is a great drug. I'm not bashing them. I think they're fantastic.
Yep. So do I.
But you have to know what you're getting into when you take them.
Yeah. It is different though. If you think about the surgical part, you did say something earlier that to me sounded like a threat somebody from Jersey would use, like, hey, I'm going to rearrange your internal organs, which I thought was pretty good. That would be a good threat that maybe like a doctor might use if he was like a mobster at the same time.
A mobster bariatric surgeon from
exactly.
Jersey.
But with that said, that's really what's happening. So I think because it's more extreme, there's more like,
attention.
Radar up, more attention to it. And this is like, hey, get a shot once a week.
Yeah.
So it doesn't have the same sort of impact, but the impact on your life is really great. How many people have you seen, as you said, that have lost a lot of weight? There's a ton of them out there, literally. And they're losing it rapidly. And we're seeing, they have this whole thing about Ozempic face and these, sort of changes that are happening in people's bodies based on the fact that they're on these medications. They are going to be healthier, like in a good way. Yeah. There's, I've seen like every time somebody tries to bring up some reason why these are, drugs are evil, like they can't back it up. Yeah. It just, the good definitely outweighs the bad.
It does. A little bit of buyer beware. And just, you really have to make sure that someone is following you, because I do have some patients that are getting their medications through telemed or some other like little bit less like in-person direct kind of source, and you can so lie and kind of fudge your way through these things. And I have some patients that like they really need to come off of these medications. They are too thin, like they are in constant anaerobic acidosis. Like they actually smell like they have ketones.
Like ketones, yeah,
because
totally.
They're just chewing through all of their fat, and I can see it when I go in and I do their tummy tucks. Like their tissues are just like slime. There's no structure to them, and nobody's following them. They're just checking their labs. They're taking a patient's self-reported weight, and they're not looking at them because it's virtual. So I definitely see some downsides to the free-for-all candy shop that some of these places are. But in general, if you're taking them, if you're getting a doctor who look at you and actually examine you and is following your labs, like they're good. There's a really great place for these in our society. Well,
so this is sort of a little bit of a public service announcement from Dr.
Yeah, we're
Millicent
really good
Rovelo,
at those. We really
that you need to pay attention. You should understand that if you go on these medications, you may be dealing with some excess skin, and that there are answers
our way very soon, which is fine. You just got to know it. You just got to know and be prepared.
Yeah, the last mommy makeover I did, which, again, for me, it's not the most common operation that I do, but she had lost a lot of weight, and, the skin was the issue. It was hanging, and, she wasn't tiny, but, like, she'd lost a good amount of weight on those medications, and she was like, I got to get this stuff off. I want to keep exercising. The skin's, getting irritated and flapping against itself. And so, the skin has skin. Mm-hmm. And it does make a huge difference to get that off and, keep losing more weight and getting in better shape, whatever you need to do. But knowing about it and having a plan is really helpful. And, of course, the crazy body lifts that you do are just, they're not easy. I don't know if anybody knows. They need to be done by a skilled and competent board-certified plastic surgeon who can help you with these body operations. They are not trivial.
They're not trivial, especially in the weight loss patients. Yeah. And I feel like everyone should know this by now. Maybe some people don't. If you're going to have surgery, you have to be off your weight loss medications at least 1 week, sometimes 2, before doing surgery. Your anesthesiologist, your surgeon will cancel you if it hasn't been a week since you've been off of them. And the reason for that is because one of the ways that these medications work is that they delay the gastric emptying, the emptying of the food contents out of your stomach. It's why you feel full. That's why some people feel nauseous, because they literally just have their food contents and their gastric contents still sitting in their stomach. And so that, in the setting of anesthesia, where they're putting you under anesthesia, they're putting a breathing tube down your throat, sometimes those stomach contents can regurgitate and end up in your lungs, and that's a huge problem. That's called aspiration pneumonitis. It's a big problem. It can land you in the ICU. So we try to avoid it.
It can also land you in a box. Let's be serious. It's very dangerous.
I've seen people die from aspiration pneumonitis. So that is why we take that so seriously, because we really want to make sure that your stomach is as empty. It's why we tell people not to eat for 12 hours or whatever before surgery. For that same reason, we're trying to get your stomach as empty as possible. So if you're going to have surgery of any kind and you're on one of these medications, make sure to stop it at least 1 to 2 weeks before your surgery or on your doctor's orders.
Yeah, I mean, the delay in gastric emptying is very real.
Very real.
It is like, it just does not move. And so you want to be at least a week, if not 2, off of off those medications before having surgery.
Yes. I think that's it.
Yeah, so, that's a good PSA. I think you nailed it.
I think we did it. Nailed it. So, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.